To another disturbing issue, and the Executive Secretary of Pharmaceutical Society of Ghana, Dr. Dennis Senna-Awiti, has called for strict enforcement of regulations governing the use of unapproved medicines like opioids or RED in the country. His call follows the rising concerns regarding the misuse of the drugs, which has adverse effect on the health of the youth. Listen to exactly what he said earlier.
I think they may be right in a sense, because as long as there's a documented proof to show that some pharmacies sell this drug, then anyone who makes that assertion will be right in doing so. But that is only part of the problem. You see, the way we run healthcare in Ghana, especially direct-to-patient care, is something that has to be looked at. In Ghana, for instance, a businessman or investor who has money can engage a young pharmacist, and that young pharmacist can, as a professional healthcare provider, help set up the pharmacy. And then the person can do away with the healthcare professional and then run the pharmacy as a business without the input of the pharmacy, or the pharmacist. And that is a big challenge. And so if we want to make headway and ensure that community retail pharmacists are healthcare providers, primary healthcare providers, there will be a need to really look at the law in itself, making sure that anyone who sets up a retail pharmacy to offer direct-to-patient care is a pharmacist. And so that person then becomes liable and responsible for any unethical, unapproved, or unprofessional service that is provided there. But as long as there is a proprietor who's a businessman, an investor who has money and make promises to a young pharmacist, bring the pharmacist, open the facility, and then finds a way to get rid of the pharmacist, all the person needs to do is to go to the pharmacy council and say that this pharmacist is no longer working for me, and the pharmacy council will get a new pharmacist to replace him. It takes some time, and sometimes they hardly close the facility.
Right.
And so these are a lot of issues that are happening in the sector. I think that coming to the fore as this issue has, I think there's a need to really look at how we license healthcare providers of provision, especially those who offer direct-to-patient care. You can leave the wholesale distribution to the businesses to run, as long as they have a pharmacist to help them. To offer direct-to-patient, I honestly think that we should really look at the law and reserve that to only pharmacists, so that can be done. It can be held responsible, where your license can be withdrawn and you can even be barred or banned from practice as a pharmacist if you are found liable.
And I heard that the Executive Secretary of Pharmaceutical Society of Ghana, Dr. Dennis Senna-Awiti. In a related development, Deputy Greater Accra Regional Commander for NACOC, Rees Hakim Udur, says efforts are underway to educate students about the dangers of substance abuse with a focus on public schools. He spoke earlier on Big Issues on TV3.
Globally, studies will tell you that between the ages of 15 to 60 years, people are already using these substances. Drug abuse is no respecter of status. We have people, white-collar job workers, blue-collar job workers, laborers. It cuts across. Nobody wants to be addicted to a substance, but drug abuse or the progression is like a slippery slope. So you go in there, and before you realize, you're already in it. We are currently sensitizing schools in Ghana West. So we are going to all basic schools in Ghana West, from Kotoku, Media, Mayera, even Wednesday we are going back. We do private, but now we are doing for the public, because the private, sometimes that's one of the challenges. They will tell you they run a strict academic calendar, so giving you slot is a bit difficult. But there are some of them that through NAPS and NACOC, we are able to, Ghana National Association of Private School, NAPS, we are able to do some of these. I know there's a private man running his or her business. It's up to him to give you Ghana Education Service will give you the letter. You take to the mistress or the principal, then the person tells you, you will hear from me. You give them the calls, you follow up. Yes, we'll get back to you. We have a tight academic calendar. But for the public schools, we are able, through the SHEP coordinators and the school counselors, we are able to get easy access. So for now, in Ghana West, we are doing schools there. And just last quarter of last year, we are to Kankwe, that's the Achimota area, Kankwe North, Achimota area. We sensitized all the schools, both private, public, secondary, and junior high school. And when it comes to the agencies you mentioned, if you look at our board, all these agencies